Let's talk about this incredible story about this first ever womb transplant in the UK. This has happened in other countries. 17 hours of operations in total involving a 40-year-old donor who has 2 children, who made the selfless gift to her younger sibling, aged 34, born without a womb, but wants to be able to start a family and carry her own child. And she's hoping to get pregnant later this year. Let's talk to Dr. Laura Donovan about this, who's a research associate at Lancaster University, specialising in the future of human reproduction. Good morning to you.
Morning.
Thank you very much. Well, thank you very much for joining us. And we're told this is a groundbreaking transplant. It certainly is for the UK. It has happened in other countries. It's something they've been working on. How important, how significant is this breakthrough?
Yeah, I mean, this is a huge breakthrough. This comes after years of research by the team co-led by Mr. Richard Smith at Imperial College Hospital in London. And as you say, yes, there have been a number of operations worldwide. I think we're in excess of 90 procedures that have occurred around the world. And so far there are between, as reported in the literature, 40 to 50 children have been born following these procedures. So, I mean, huge breakthrough, very important for the women who have absolute uterine factor infertility, for whom prior to this, you know, there was no directly comparable reproductive solution to enable them to have their own children. Of course, these women could always adopt children, use surrogacy, but these things are not directly comparable in that they don't offer the unique experiential dimension of uterus transplantation.
Well, you're talking some very long words there. I'm thinking just the wonderful joy of carrying your own child.
That's what I mean. So it's a unique experience, isn't it? Yeah. To be able to carry your own baby rather than having to rely on a surrogate.
And I know lots of women. I went through, I mean, like my daughter was born naturally, thankfully, but I went through IVF, but I also had a load of miscarriages. And I mean, it's absolutely harrowing, and meeting so many women who'd gone through far, far worse than me and didn't have a child. But the urge that women have to carry their own child, or lots of women there, you know, using surrogates to try and have a baby, using donated eggs. But this woman, luckily 34, she does actually have eggs, so she's frozen eggs, so she can carry her own child. But this isn't, I mean, it's an incredible breakthrough. Lots of people are talking about this future. Now, there aren't that many, you know, this is not the main cause of infertility. There are many, many other causes. So this won't be something that will just be routine. This is a huge operation. Some people are asking about the NHS resources involved in this, the number of doctors, the number of hours, the operating theatre, the risk of, you know, general anaesthetics for both. And I suppose, you know, as much as I'm full of joy for this mum, because, mum-to-be, we hope, because I would hate not to be a mum myself. Is this the right use of NHS resources?
So I think on the face of it would seem that public funding is justified in the interests of patient autonomy and well-being, especially if we take the psychological harms of infertility seriously, as we should do. That said, you know, there's a delicate balance, isn't there? I mean, we live in a country in England where we have a postcode lottery of IVF treatment. It's not routinely funded across England, and that's a major problem. And so you add in a treatment like this, which is not only a transplantation procedure, but also requires IVF to create embryos. So we're talking a significant cost. And I think that's going to be a really difficult decision that for NHS commissioners to make. One thing I would say is that this isn't something that's likely to be funded by what are now called integrated care systems, so what were previously clinical commissioning groups.
Right, because so you probably would be private, people would have to go private to get this.
No, so essentially, uterus transplantation is classed in law as a specialised service. So what that means is if it's going to be funded, it will be funded by the body that is NHS England centrally.
Right, so you wouldn't be a local health, so local health trusts aren't going to be deciding on this. One thing that has also been raised in front of one of the papers today is the future of these womb transplants, not just for women who need a working womb or a womb at all. This woman who got the donation was born without a womb, but also for men who have transitioned to live as if they were women, would like to bear a child. We've had stories in the news over the years, you know, of first man to get pregnant. Of course, they're actually biological women who've got pregnant. Is this something that could be used to give men wombs to allow them to carry a baby? And would that be ethically all right?
So I think this is a conversation that is coming down the pipeline, especially as success in cisgender women, you know, and we have more and more...
No, sorry. Sorry, Laura Donovan. I know you live in the world of academia. No, there's no such thing as a cisgender woman. You just use the word women. The word is women.
There are obviously different hormonal and anatomical considerations that mean it would not necessarily be a case of directly translating the procedure. There are other considerations to take into account for the population.
So you're going to have the women. The thing is, my body and every woman's body is designed to know what to do when you get pregnant, to feed the baby through the placenta and all those hormonal changes, whereas a man's body, because he's not meant to carry a baby, wouldn't be. So you can put a womb in there, but there would have to be probably an awful lot of extra help. I mean, there would be ethical considerations for the safety of the baby at that point, wouldn't there?
Sure, and there would have to be a wider debate about the safety and efficacy, of allowing these transplants as well in the population of trans women. That said, there may well be strong equality-based reasons for considering uterus transplantation in trans women. For example, under the Equality Act 2010, we know that gender reassignment is a protected characteristic. So if this procedure, if there were no clinical considerations barring the translation of this treatment,
they would be entitled to it. Fascinating. Dr. Laura Donovan, really appreciate you joining us. She specialises in the future of human reproduction at Lancaster University.